What's up, you guys? Today is Sunday, February 18, 2024. I'm going to be doing a little update on my peptide therapy with Merck Health. Merck is sponsoring my treatment protocol. That means they're providing all of my blood panels, medical advisory, as well as the peptides themselves and any other compounds I'll be using. And I'll be discussing what those are in a moment. And also I have a coordinator, Michael Warner, who's helping me just keep everything on track. So I started this last week, Super Bowl Sunday, and I have a list of like a checklist of things that I'll be going over. By the way, this is unscripted. I'm just doing this in one take. So I'm going to try to keep it on track, and I'll keep it short if I can. All right. So I already gave you the date. My age, I'm 55. I think a lot of you know that. I am 6 feet tall. And I've been weighing myself every day over the last week, and every morning I weigh about 198 to 199 pounds. So that's been pretty stable. Okay, about 198 pounds in the morning. I'm taking, let me tell you what I'm taking. The 3 peptides, BPC-157, TB-500. Those are, I'm doing them for my joints because a lot of my joints, my ankles and my knees especially, they're getting progressively more sore. I mean, I feel like the inflammation, I do have some wear and tear over the many years I've been beating them up, but over the last 2 years, it's been getting progressively worse to the point where it is starting to affect just my daily function, let alone my workout. So the BPC-157 and TB-500 are hopefully for that. And I'm also taking Tesamorelin, which is what's called a growth hormone secretagogue. I hope I'm saying that properly. It is not growth hormone. None of peptides, for those of you who don't know, peptides are not hormones. They are not testosterone or any kind of hormone replacements. And the Tesamorelin, as a growth hormone secretagogue, just helps the body either secrete a little bit more of its own endogenous growth hormone, and I believe it also might help at the receptor end. So it is supposed to possibly improve receptor affinity to whatever growth hormone is being produced naturally by me. But I guess on the receival end of it, it's supposed to help me use more of the growth hormone I have available. I am also taking, and those are all injections. They are administered with a insulin needle, subcutaneous insulin needle. So I give myself, since there are 3 of those peptides, I give myself 3 injections a day. And I'm also taking pregnenolone, and DHEA, and those are capsules. I take 2 of those a day. So I'm taking 4 things. All right. Just give you a quick update on how things are going. In 1 week, like I said, I'm not an expert on this. I'm brand new to all of this stuff. I've heard from trusted sources, both personally and online, that these peptides are quite effective in helping with joint and gut and brain health. So that's what I'm hoping for. So I'm going to run down my checklist. And I know that in 1 week, none of these things are supposed to have any significant effect. It apparently takes 4 to 6 weeks before their effects start to become apparent. So just keep that in mind as I discuss what's going on here. All right, so joint pain and functionality, I would have to say that the inflammation in my ankles, they actually sometimes get swollen, both of them. Some days are better than others, but they're very stiff. Going downstairs is problematic. Going upstairs, less so. My knees also, they used to be one of my best joints, and now they are rapidly becoming my worst. And I'd have to say, I test my squat, I test myself on stairs, also jogging and walking, and I feel about the same, if I'm being honest. Okay, I feel everything is about the same. Energy levels, my energy going into this was pretty good. You know, I cleaned up my diet many months ago. I really, I cut down a lot on sugar and starchy carbs. I'm now having a more regular diet. I'll do a separate video on that. But I'm not doing anything special. I don't measure anything. I don't count calories or any of that. But but my energy's been good ever since I cleaned my diet up. I got rid of a lot of sugar and dairy and stuff. So I think it's fine. But I wouldn't say my energy is better at this point. It's just good. Now here's what is significant. I didn't contact Merck about this, but in 2012, I was diagnosed with stage 3 colon cancer, and it was pretty severe. I had to go right into the hospital, and 13 inches of my colon, my ascending colon, were removed, and then followed quickly by 6 months of pretty intensive chemotherapy. And apparently, you know, the treatment worked. I'm still here. But my guts have never been the same, both having over a foot of them taken out, and then the chemotherapy, it was hard on everything. It destroyed it affected a lot of the nerves in the tips of my fingers as well as in my toes. And to this day, I still have those effects. I'm still dealing with that. I have a lot of numbness and tingling and burning in my feet. My hands are a lot better, but and I think a lot of what's going on with my ankles and my feet might have to do with the effects of the chemo many years ago. Okay, so in terms of joint pain, okay, but got off the topic. What I wasn't expecting is, you know, I don't really like to talk about it too much, but, you know, my guts, like I said, were never the same. And one thing that had happened within 3 days of taking, especially, I guess, the BCP and the TB-500, was my guts became much more like the way I remembered them being, much calmer. And so I looked into this, and oddly enough, a lot of people use the BPC-157 and the TB-500 to treat IBS, or irritable bowel syndrome, as well as Crohn's type disorders and other ulcers and things. I didn't really know that. I was just wondering, wow, my guts just feel so much better. So that, I would have to say, is very significant and a very welcome effect, because I believe I also suffer from leaky gut syndrome. I'm not going to go into what that is. A lot of information online about it, but it results in inflammation, systemic inflammation in the body. So hopefully, in these peptides having a positive effect on my guts, I'm hoping that that might be, in fact, what helps my joints in the long term. But it's only been a week, so I'm not expecting that much at that point. It'd just be, yeah. Okay, brain function. I'd have to say brain function, it's kind of hard to say with my brain, but the DHEA and pregnenolone are supposed to be really helpful in terms of helping brain function. I would say that I'm functioning, if I'm being honest, about the same as I was last week, you know. I don't know if that's good or bad, but anyway, I feel like I'm functioning just fine compared to the way I was a week ago. I'm certainly not any dumber. I hope not. But yeah, okay, so I'd say at this point, no real change. Mood. No, my mood has been pretty even for a while. I wouldn't say I'm feeling, I have heard that as I get farther into peptide therapy that it's supposed to actually make me feel quite happy and peppy and good, but I kind of feel like that most of the time anyway. So if I get any more, then hey, I'll take it. But I'd have to say my mood has been just good, and I'm really happy to be trying this. That's exciting for me. So I would say that's boosting my mood, just doing something new and looking forward to a good result. But if I'm being honest, I'd say my mood is just about as good as it was a week ago. Skin and hair. I'd say my skin doesn't feel it doesn't feel like it's getting worse. And yeah, in 1 week, what do I expect in terms of that, right? It's all good, fine. Exercise, my joints still complain to me about the same amount when I do something different every day. So I'm always making different demands of my system. And I would have to say, if I'm being honest, I feel about the same. I'm able to do what I want to do, but I'm still restricted by pain and tightness. And I'd like to see more improvements going forward in terms of joint mobility and just how comfortable my joints are. Okay. And then I already discussed my weight. It's been stable at about 198, 199 pounds. In the evening, I tend to come in at about 201, maybe 202. It's just water and whatever. So, but yeah, that's the 1 week update. Sorry that went so long, but if you have any questions, please let me know in the comments, and I'll answer the best as I can given the knowledge I have. All right, you guys, I'll check in a week, maybe less, especially if something real profound comes up. But I'll see you next time. Aloha.